Hi, this is Dr. Matt Lawless, bringing you another knee moment from Knee Fit and 5 and MSM products. Katie from Idaho writes in asking, what are stem cells and are they helpful in treating knee pain? Stem cells have become very popular recently for treating knee pain. The potential of stem cells sounds very appealing, as stem cells are very young, immature cells that in theory can grow up to be any kind of different cell. So when we are young, just developing in the womb, we are full of stem cells, and the stem cells become everything in our body. They are young, immature cells, so they grow up to become muscle cells, fat cells, skin cells, gut cells, brain cells, whatever your body needs them to. So in theory, injecting stem cells into a knee with cartilage issues could, in theory, help the cartilage issues. It is still a theoretical thing, and more science needs to be proven, but more of that in a minute. So where do stem cells come from? Well, there's two common forms of stem cells. Stem cells can come from you. We as people still have stem cells even as we become adults. The most common place to get them is from bone marrow. So bone marrow is the substance inside of a bone. So what you can do is take a large bore needle or a fairly big needle and then put it in your iliac crest or hip right here and aspirate some bone marrow. You can then take that bone marrow and take the stem cells and inject them into your knee and use that as a form of treating knee pain. Another common source of stem cells is from umbilical cord. So after a baby's been delivered, there's still some blood remaining in the umbilical cord, and that can be aspirated and also used as stem cells. Those are very young stem cells, and those can also be injected into a knee for treatment. Some people also use embryos. So an example would be like a in vitro fertilization where the egg has been fertilized and after 5 days or so been kind of aspirated, then that can be used also. There's some obviously very much ethical concerns about that, but the most common kind would be either from yourself, and that's probably the most common, doing a bone marrow aspiration, or from umbilical cord. So the thought is to inject these stem cells, young immature cells, into a knee and have them treat the inflammation and also treat any cartilage or other damage to your knee. So are stem cells effective? So far, we don't have any real scientific research that shows us that stem cells do offer any good treatment. There's a bunch of testimonials, but no real scientific research saying that stem cells actually help or make a difference. It would be great if you had someone with some knee arthritis or something like this. You can inject some stem cells and have cartilage grow on the area of the arthritis and prevent the need for a total knee, for instance. But so far we have zero science to support that claim. Most stem cell injections are very expensive. It can be several $1,000s. So typically I suggest to my patients to hold off on doing it until we know if they're going to work or not, as it is a big cost and so far very unproven. So currently I would say save your money, work on your rehab. If your knee is that sore, try other kinds of injections, but that's the way I would proceed. Thanks.